Hi, my name is Dr. Ijeoma, and I'm a reproductive endocrinology and fertility specialist at the Institute for Human Reproduction, or IHR, in Chicago. For my training, I've bounced around to all the continental time zones, starting with undergraduate studies at Duke University. I did my medical school training at Brown University in Rhode Island, and then went to California for my residency in OBGYN, or obstetrics and gynecology, the University of California, Davis, and then finally completed my reproductive endocrinology and fertility fellowship training, or REI training, at the University of Utah, and now I'm back in the Chicagoland area. For what I do, I think it's such a huge honor to be able to take care of patients like you when you're walking in the door or logging in virtually to these appointments. We know that our patients have already gone through so much, and so every patient, to me, it's an honor that they have taken the time to meet and speak with me, and I take it like a job interview. I want you to know that you have choices in the fertility care that you get. And my job is not to sell you on anything, but to walk through your diagnoses, your history, understand how you guys are doing emotionally, because it's a lot. It's a lot to be here and be in front of us and kind of bearing everything, because a lot of us assume that it'll be easy to get pregnant, but we know that for 1 out of 5 people, it's not easy. And so you're not alone, but that doesn't make it any less difficult. So my job is to help with that process. Something that I take very seriously about my job is doing my very best to instill hope. So we know that for patients that are able to kind of continue with fertility treatment over time, that the vast majority will be successful. And sometimes it happens when you least expect it, when you've been trying to get pregnant and you get to your first visit and you realize your period's late, you have a positive pregnancy test. We love those stories, but sometimes that's not the case. But we know that if you can persist and have the ability and the support to continue to seek care, that again, a lot of our patients will get to their goal. All right, so when I'm not here taking care of patients, I like to think of myself as a programmed TV connoisseur. So, if we ever need a little distraction, I'm happy to chitter-chatter about any of the things that you and I are both watching. Also, more recently, I'm on a fantasy book kick. So many a patient waiting for procedures had like a Fourth Wing book in their lap, and there's nothing I love more than to talk about all the possible theories for the next book whenever she finally gifts us with it.